Madam President, I came to the floor this afternoon to announce that I will be voting against Congressman Price to be the Secretary of the Department of Health and Human Services. And despite some of the remarks that people have expressed, I feel passionately about the fact that this is the wrong person to serve in that job. And I've heard from a remarkable number of my constituents who also believe this is the wrong person for the job. Congressman Price is an outspoken advocate of repealing the Affordable Care Act, which would cause up to 30 million Americans to lose their health insurance and put at risk the lives of thousands of people in New Hampshire and across America who rely on the Affordable Care Act, or Obamacare, for treatment of substance use disorders. He is a rabid supporter of defunding Planned Parenthood and denying women our reproductive rights. If he defunds Planned Parenthood, it would mean that women would lose access to contraceptive services and cancer screenings. In New Hampshire, we have thousands of women who rely on Planned Parenthood as their only source of health care. And Mr. Price is determined to make billions of dollars in cuts to the Medicaid program, which would jeopardize the health of some of our most vulnerable citizens, including millions of children living in poverty and millions of seniors living in nursing home care. I am especially troubled by the threat that Representative Price poses to women's health. I urge my colleagues to listen to the millions of women across America who marched last month in opposition to the policies of the Trump administration and Congressman Price. Those of us who marched on that day had a simple and powerful message. We will not be dragged backward. We will not allow the Trump administration to take away our constitutional rights and to interfere with our deeply personal health care choices. And yet Dr. Price's extreme policies would do exactly that. They would drastically undermine women's access to health care, and they would turn back the clock on women's reproductive health and rights. Representative Price has spent his entire congressional career authoring, sponsoring, and voting for legislation that would put women's health at risk. He co-sponsored and voted 10 times, to defund Planned Parenthood, repeatedly championing slashing funding and access for family planning services. And if we want to cut down unintended pregnancies and abortions in this country, we need to give families access to family planning services. If Congressman Price succeeds in making good on this threat as Secretary of Health and Human Services, it would result in 1.5 million Medicaid patients losing the ability to see the family planning provider of their choice. And as Senator Peters says, Mr. Price does not support the Affordable Care Act. The requirement in the Affordable Care Act that women have access to FDA-approved methods of contraception with no out-of-pocket costs. Indeed, he rejects the very idea that women should obtain birth control with no out-of-pocket costs. He said, and I quote, "Bring me one woman who's been left behind. Bring me one. There's not one." Well, that statement is not only wrong, it's arrogant, and it is gravely out of touch with reality. Throughout his career in Congress, Dr. Price has been a zealous advocate of restricting women's access to contraception and abolishing our constitutionally protected reproductive rights. He has co-sponsored an extreme personhood bill, so-called, that would establish that life begins at conception. And he supported a bill to ban abortion after 20 weeks, despite the Supreme Court's rulings that similar bills are unconstitutional. He even voted for a bill that would alter the recommended medical training for obstetrics and gynecology by preventing grant funding from being used to train medical students on how to safely perform the abortion procedure. The policies advocated by Representative Price would have profoundly negative impacts on the health and well-being of the people in my state of New Hampshire. Repeal of the Affordable Care Act would have devastating effects on people in New Hampshire. Some 120,000 Granite Staters, nearly 1 in 10 people in New Hampshire, have enrolled in health care coverage thanks to the Affordable Care Act, thanks to Obamacare. That's an enormous step forward for the health and well-being of the people of my state. And yet Dr. Price is determined to destroy that progress. Indeed, he seems to have no higher priority than to terminate health coverage for millions of people across this country. And make no mistake, repeal of the Affordable Care Act would destroy much of the progress we've made in New Hampshire and in other states to fight the heroin and opioid epidemic. Across this country, more people are now killed by drug overdoses than by traffic accidents. There were more than 52,000 overdose deaths in 2015. But statistics can't fully capture the profound human toll. It's not only the thousands of individual lives that have been destroyed, entire communities are being devastated. And in dozens of visits to New Hampshire during his campaign, President Trump pledged aggressive action to combat the opioid crisis. Keeping that promise is a matter of life and death. And make no mistake, Representative Price's determination to repeal the Affordable Care Act has put millions of Americans at risk. I'm especially concerned that repeal would abruptly end treatment for thousands of Granite Staters fighting addiction. The Affordable Care Act and Medicaid expansion in particular, what we call in New Hampshire our New Hampshire Health Protection Plan, which had bipartisan support from then Governor, now Senator Maggie Hassan, and the Republican legislature, has been a critical tool in combating the opioid epidemic. More than 48,000 Medicaid claims were submitted in New Hampshire for substance use disorder services in 2015. And having traveled across our state in the past year, visiting treatment centers and meeting with individuals struggling with substance use disorders, I am convinced that Tom Price's plan to repeal the Affordable Care Act would mean that thousands of Granite Staters would lose access to treatment with devastating consequences. Because right now, even as we're beginning to ramp up treatment, we have the second highest overdose rate in the country. We need a Secretary of the Department of Health and Human Services who will respect women's health care choices and our constitutional rights, and who will defend the enormous progress we have made thanks to the Affordable Care Act and the expansion of Medicaid. Representative Price is the wrong person for this critically important position in our federal government, and I will vote against his confirmation.